Hello, and welcome to the Raw Report. I'm your host, Ryan Jackson-Saw. We're talking today with Verka Evelyn, a nurse who's been working for the last 7 years in the medical hospitals and in the nursing care. And she was recently given an ultimatum to take the double jab or lose her job. Today was her last day working as a nurse, and she's decided to speak to A&R News and tell us what's really happening. Hi, welcome, Verka. How are you?
Good, thank you. How are you?
Very well. Tell us, why did you become a nurse to begin with?
I, previous to becoming a nurse, was very interested in becoming a midwife, actually. I was working in an industry of gas and electricity and didn't get the fulfillment that I would have if I was actually helping people. And I've always wanted to, from a very young age, be in a position in my life to help people the best way that I can. And so about 7 years ago, I had an epiphany and realized that that is the role for me, is to get into a position where I start helping people. So I initially became a carer, and then I did my nursing, and I've been in that industry for about 7 years now, and I get so much fulfillment out of it. And it's a very, very sad day today.
So what's changed that's made you want to leave the through nursing and palliative care?
I'm actually not allowed to be there anymore. I've been told that if I don't get the vaccinations that are available to me by the 1st of November, then I'm not allowed to step foot in a hospital. That actually happened to me in September as well. I was in aged care, and I was told that I had until, I think it was the 17th. Don't quote me on that. I'm not quite sure if that was the exact date, but it was in September. And I was told that if I didn't have the ones available then, that I would be terminated. I could be terminated. That was what they said. I didn't openly refuse. I just said, I need more time. This is a lot of pressure. I personally did a lot of research on the type of vaccinations they are and how new they are and the adverse reactions. And I've actually got a medical condition called adenomyosis, which is the thickening of the inside layer of my uterus, which is a huge clotting factor. And the clotting factors of the ones that are currently available are a danger to me. Unfortunately, there's no doctors that are willing to write an exemption, though, because it puts their registration on the line as well. So I was actually terminated from my role in aged care. And now I'm not able to work in hospitals either. So I've had to change industries as of tomorrow.
Those basically exemptions from getting the vaccine, they're very, very limited, aren't they? And there's a whole host of people
I'm not sure.
that should get exemptions, but they're just not.
Yeah, from my understanding from a few people that I have spoken to that do have medical conditions, I've only heard of one. I don't know the details, but it's to do with her blood. She has blood issues. She actually did receive an exemption, and her workplace did accept it. But there's been multiple other cases that I've heard of and discussed with other people in similar position to myself who have not been able to get exemptions when they really should, even if it's just to buy a little bit more time until a more traditional vaccination is available, which is the Novavax, which is on its way. We're not given any lenience. It's take it or get out.
Right. That must be quite stressful for you.
Yeah, it has actually been very, very stressful. I do have I'm lucky. I've got a handful of people around me that are very patient and happy to listen to me and have me talk it out and that sort of thing. And I'm also very lucky to be stepping back into a workplace where I still have quite a few close old work colleagues that will guide me back into that position, and I'll still have some form of stability. But there are so many people in a situation like myself that don't have an option.
Well, that's
do not have a choice. They do not have another career to step into.
There's literally tens of thousands of nurses right now that are out of work because of these mandates. That's a recent study
Yeah.
actually by Monash University that showed that 30% of nurses are considering quitting right now because of what's happening within the hospitals. And that's what we're trying to get a viewpoint of what is happening in there right now. Why are so many medical staff
Yeah.
leaving?
This is a very, very controversial topic because the immediate response from many people is that you aren't a virologist and you don't have a degree, that involves vaccinations and their makeup and their study and so forth. So having an opinion that I do is not valid in the eyes of many, but it's a lot of them would be not, it's not just the coercion and the force. That is a huge part of it. We should have autonomy of our bodies. We should be able to have a say of what goes in our bodies. The worst part of that for me, though, is that there are so many that don't even know what it is that's going in their bodies, and it is still in experimental stages. And I personally, firsthand, have seen a lot of adverse reactions. I've actually seen a lot of deaths that I truly believe were linked to the reactions that that particular person had from having the vaccine in the past few months. But once again, doctors are not willing to record it as that. They don't make the link, will not document that it is even a possible link, which is very, very frustrating.
Yeah, I
Because
can imagine.
it's very apparent. So it's very much about the fact that for me, I can't speak for everybody else, but for me, it's the type of vaccinations that are available right now are still in very early stages. They have had their time frame of testing, but they haven't been used in mass production this way, and they haven't been used in the format that they've been used now as well. And I'm not comfortable with the mode of action of the vaccination, which essentially, I'm not a virologist. I don't do all of this. Is not my absolute profession, but you can look it up yourself. Anybody can look this up themselves. The mode of action is that it is a messenger. These are the mRNA ones, which is the Pfizer and the Moderna. AstraZeneca is actually a viral vector. They're very similar in what they do, but they actually teach your body to create a replication of the spike protein, which travels throughout your body wherever it likes to. And your attack cells, your T cells, will attack it on site and cause inflammation and clotting. It depends on where it travels to and how many your body makes and so forth, to how bad it gets and what happens to you. But there's 30-year-olds that are having pericarditis. They're having inflammation of the heart. There's people with unexplained clots in their lungs and that were perfectly healthy prior to it. I'm not saying everybody that gets the vaccination is going to die or have major health conditions. I'm just saying that there is that risk, and that because it is very apparent, and even people that are pro these vaccinations are aware that there are adverse reactions, we should have a right to say, well, I'm not comfortable with that. I'm not willing to have that happen to me. And we should be offered a more traditional option. Which is, as I said, I keep talking about it, but the Novavax is a very, very traditional. The mode of action is just a protein, very similar to hepatitis B. It's a protein vaccination. It enters your body. Your body recognizes the replication of the protein inside of you, and it attacks it, recognizes it, creates the antibodies, and you're all done. It doesn't travel. Your body's not creating them. It's way simpler and there's very few reports of clotting and inflammation post those vaccinations. So I'm way more comfortable with that. I've had every single shot I'm supposed to have as a nurse, and I've never hesitated. I'm hesitating now, but I'm still being labeled an anti-vaxxer and a monster for wanting to kill my family. And it's been quite horrendous, the abuse I've received for not wanting to do it.
A lot of people would say that it's still quite early to call this a vaccine, as it hasn't passed those stage 3 clinical trials like you're saying.
Absolutely. It's a medical treatment and it is an experiment.
Well, yeah, we've never seen forced medical experimentation on an entire nation before. So it seems quite reasonable that people would be hesitating and thinking before just jumping straight into it. We don't hear a lot of doctors and nurses speaking out in general about the COVID-based restrictions or these vaccines. Why are they not speaking out as much as you think they would be at this time?
There is a lot of silencing occurring as a part of your registration as a nurse within your ARPA registration. I haven't got the exact clause that's within the write-up of what we are supposed to abide by, but it is, if we are to speak out against something that is mandated, we can lose our registration. I'm more than happy to send you some information about that after this interview, but there is a lot there, and they are all in fear and of the risk of losing their registration of the career that they've chosen. So why would they risk that? Being quiet is much easier.
So why are medical professionals not allowed to practice medicine as they see fit? It seems contradictory to good health.
It absolutely does. And I don't have a logical explanation for almost anything that's happening right now. It's completely unprecedented, and we're losing control by the of our own lives and of our own ability to support ourselves, our family, and make choices for what we think is best for our own health. I don't have a direct answer for that. I wish I did.
Oh, thank you. In a previous conversation, you mentioned that nurses are not just being silenced, but eradicated. What did you mean by that?
So I have firsthand heard of other nurses in other situations that have been reported to have been speaking out against the mandate and the vaccination, and they have been let go from their positions for other reasons, complete other reasons. They've found other reasons, and they've tried to ask, what is this particular situation? Why am I being let go? I've given them a completely different reason, and they've had to leave. One of my old workplaces, actually, I've heard of at least 3, maybe even 4 that were let go, that had been there for years and years and had always done the right thing and were always, following the rules and working within their code of conduct in every aspect. But this one time that they decide to be quite open about their beliefs and their views, all of a sudden they've been terminated for another reason entirely. Well, that was what they were told.
Right.
It's extremely frustrating. And I'm outraged. I am outraged, and I'm willing to do what it takes to try and fight for this. And I encourage everybody else that is in a similar situation to me or feels outraged to stand up with me as well, because it's not right.
Well, how many? There's another thing to examine right now is talking to other nurses. There has been a very large difference in the numbers of patients that doctors have seen coming into the hospitals before the vaccinations were rolled out and after the vaccinations were rolled out. Have you noticed that?
I have noticed that, and I've also noticed the types of presentations have changed as well. I have a friend who works in radiology, and she has had way more cases of inflammations of the glands around in certain aged women that have directly post-vaccination as well. So major inflammation around this area, which has increased her workload dramatically. And she's put 2 and 2 together and realized that it's always within the first month of having their vaccination that this is actually happening. And it was never the case before. It was always, sporadic. I noticed the types of presentations within the hospital has changed as well. So we're dealing with a lot more stroke situations, unexplained people that were completely healthy. I had one in particular who was in his early 70s, owning his own business, and all he had was what we know as GORD, which is like reflux, and he had rheumatoid arthritis and absolutely no other health condition, constantly had health checks, had his vaccination and collapsed directly afterwards, was nursed back to health. After his second one, he had a stroke within the first week of having it, and he lost 30% of the left side of his body, completely unexplained, but nobody was willing to investigate or say that it could possibly have something to do with it. Wow. I've not once seen a report to say this has happened or possibly could have happened as a direct result of this vaccination. It has been avoided completely, which tells me that how can we believe anything that we hear or any reports or any statistics? how can we believe the death rates and the reasons for death and all of these sorts of things if they're not even willing to say it's a possibility in any report? And I have read multiple notes from doctors after situations that are so clearly related that I just don't know what to believe when it comes to anything anymore. But there, as you said, there is a very one-sided view being put forward via the media to the general public as a form of coercion, I believe, to create a certain narrative, as you said, a certain narrative for them to do what they're supposed to do or what they're told to do. It's very scary, actually.
It certainly makes it very easy for them to do that if doctors and nurses aren't recording the adverse effects. It's not just yourself who's mentioned that. Quite a few other doctors and nurses I have spoken to in the recent months have been told that they are giving orders directly not to record these events. Did you see that yourself in the hospitals?
Yeah, I've heard the hushes. It's never been something openly spoken about in a loud voice in a room where others can hear, but I've heard the hushes of people saying, this is the case, this is what happens now. Other nurses who have been vaccinated that were coerced to do so because they have no other choice to do so, that are still saying that guy died because of a stroke and he died because of the vaccination, and I know it, and the doctors, they've said it. And they've had it themselves, and they don't, it's just, and they're just like, what can I do? I'm just a nurse. I can't change that. I can't. What's recorded is recorded. What's written on the death certificate is written on that death certificate. We're powerless.
Among all this adverse effects that are happening, and the power games that are happening, and the people getting fired and sacked en masse across the country, why is nobody talking about natural immunity?
It's a really good question. And it should be an option available, and it should be reported, and it should be spoken about by everyone. I wish that I knew why that was the case, but I've got a group of friends who we all speak about it, and there are other options available. And even just I've not seen in the media anywhere regularly exercise, get sunlight, have vitamin C, have some, zinc and vitamin C, boost your immune system. That there's no, it's all fear campaigning. It's all get the vaccine or die. That is the only thing that people are hearing at the moment. But there's also other treatments as well if you were to actually get COVID. Ivermectin being one of them, but as I said, I'm not a specialist, but I've done a lot of research into alternative treatment methods as well. But it's been hushed. Everything's being hushed, and it's just concerning to me as to the reasoning behind all of this. And I know there's plenty of theories out there, and I definitely don't want to be labelled as a conspiracy theorist because I've never really considered myself a conspiracy theorist, but I do consider myself a free thinker, and I do consider myself a truth seeker, and we're not being fed the truth.
Well, more than that, you're a professional nurse, and that's why what you're saying matters. Do you think that the Australian government should bring back the Life Be In It campaign?
Walk, walk, walk. Walk, walk.
Go, 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 go.
Go, gallop, run, shuffle.
Jump, giggle, cycle, hit.
Sway, wriggle, paddle, sit.
Hop, tickle, handle it.
Be in it. Today, live more of your life. Be in it, yeah.
Yeah. That's an option for sure. Absolutely. There are plenty of alternate campaigns that they could be bringing about that are going to be much more positive and achievable and a healthier choice for a lot of people, but I can't see it happening
Absolutely
anytime soon.
Yeah, being outside, socializing, getting vitamin D, being active. These are things which are synonymous with good health, of course.
Stay hydrated.
And I hope all our listeners
eat
out
fresh
there are
fruit
doing
and vegetables.
just that. Yeah. What impact has the suspected COVID identification process had on our services? Sure.
I actually, as a part of my nursing, worked in the COVID clinic a lot. and the amount of resources that had to be flooded into the COVID clinic as well, just for people having to get tested, and truck drivers that were having to get tested every 3 days, and the bleeding in the nostril, and the constant interrupt sleep because of their having to get it done during the day when they're driving at night and things like that. I've seen a lot of our services being wasted, and I'm going to say wasted on, like you said, suspected cases or presumed cases of COVID as well. We also, if anybody has, in hospitals, if anybody has a little bit of a cough or any one of the symptoms of COVID, we have to use all of our physical resources as well, our PPE, so our personal protective equipment and gear, and put it at the front of their room. And every single time we enter that room, we have to put all that gear on in the precautionary methods to ensure that we are safe from it. Even though, and as nurses, none of us are wearing the N95 masks. We're just wearing your standard blue mask as well. So
right.
I don't know what that tells you, which doesn't protect you from anything, if I'm honest.
Well, yeah, let's go into that for a minute.
There is a waste of staffing and resources. Yeah, sure.
Yeah, the mask. So it doesn't protect you from the virus, is what you're saying?
No, the ones that we're given on the wards, the ones that we're given in hospitals, doesn't protect you from. They have mask fitting through government. I work through the government. We have mask fitting regimes where they can make sure that we have a tight fit and a close fit for the proper N95 masks. But we've not been supplied them at all. And we've been in this pandemic for how long now?
Yeah.
Also, ironically, I find so many things very bizarre and ironic, but in the COVID clinics, the nurses that are filling in the paperwork and are in the reception area don't need to wear N95 masks at all. They can just wear your standard surgical mask, which does not protect you from the virus. Only the people physically doing the swabbings actually wear the N95 masks. So, bizarre.
Well, during a pandemic, wouldn't that mean that every single nurse would be sick from COVID?
Absolutely. I personally haven't met a person who's had it.
Right. Well, that tells you a lot, doesn't it?
So.
Yeah. So we have.
I work in the industry.
Well, we have this mandate, and I personally find it ridiculous that every single person walking through the streets is wearing these masks. And they're breathing into it. They're getting bacterial infections. They're touching it, and they're touching everything. If there was a pandemic, I think it would be probably one of the worst things that we could have done. But what do you think as a nurse?
Yeah,
you think
absolutely.
that it's helping?
No, absolutely not. There's actually a study from a guy in the UK who checks the cognition of your brain and the amount of carbon dioxide that you're constantly circulating and breathing back into your lungs, and how it lowers brain function. It's actually doing us more harm with the, as you said, bacteria, constant carbon dioxide recycling that's happening. Other respiratory issues, people with asthma, it's causing exacerbation of those conditions as well. It's actually a very unhealthy thing to be doing, especially for those of us that work 12-hour shifts as nurses. We have to wear the mask the entire time.
Yeah.
Anytime we can take it off is in the lunchroom when we're eating, and then it goes straight back on. It's not great. Not great.
Is that constant exposure to increased carbon dioxide and monoxide affecting your immune system?
I would say so. It's definitely affecting us in the study that I read was brain function, but yeah, it would. You're not getting fresh air. Isn't that one of the first things that you're told?
It seems to be essential. That's what I
feel. Of good health is fresh air. Absolutely. And we're being starved of that. Yeah.
And one more question: with the saturation of suspected COVID cases throughout the hospitals, and all the ambulances are being tied up en masse, do you think that that's going to lead to more deaths overall, as people aren't able to get the ambulances, aren't able to get hospital beds?
Absolutely. I mean, we are lucky. I'm lucky enough. I know you're not in South Australia, I don't think, but I'm lucky enough in South Australia to be in a state where we don't have a lot of cases, but where there are places where they are inundated with suspected cases, and even cases that are mild. There's from my understanding, there's a lot of people that have COVID that don't even know they have COVID, that are not needing hospitalization or anything. But there is an inundation of that, and there's going to be people that actually do need the medical care and help and assistance, and the services just be available there for them. So yeah, I absolutely think there will be a huge rise in deaths from inability to access aid.
It's quite concerning. It seems that the more we're trying to control this virus, the worse we seem to be making it.
Absolutely.
Are you disappointed in the way that the government's handling this this crisis?
In search for a better term, I don't think disappointed quite covers it. I'd love to find a more appropriate word for it. I'm appalled. I'm actually ashamed. I guess that's a really strong word, and it is how I'm feeling. I'm ashamed to be in the profession that I'm in, because I'm a part of this, and I'm supposed to be supporting this, and I don't, hence I'm leaving. But I'm disturbed, I'm ashamed, I'm appalled. I could probably write a little novel on the words that I'm feeling, but disappointed doesn't cut it.
Well, thank you for that. What would you need to change in the system for you to consider coming back as a nurse?
That is a very good question, and I wish I had a straightforward answer. I would like people to become more educated. I would like more people to know the truth. I would like people to be able to make decisions, and I would like a little bit more freedom and leeway for us as nurses to be able to continue to work and do our job and assist other people that especially definitely need it. There's got to be a lot of change. But this control is not going in a great direction, and it's not going to lead us down the right path at all. It's actually causing more of a division than unity, and it's tearing the country, if not the world, apart. And there's so many more effective ways of managing and dealing with it that I can think of off the top of my head. But yeah, than what they're currently doing. It's ridiculous.
I have a last question, and it's a difficult one. What do you think that we need to do as a country to come back together again and take control of the situation?
Say no. Just say no. Don't. We are stronger in numbers, and the fear that we have been fed has created a sheep-like mentality where people just follow the herd. They talk about herd immunity, but they're causing a herd reaction to their mandates and everything that they're pushing on everybody. And people just need to stand up and unify, really unify for their future, for their children's future. Society is not going in a great direction for our children. I'm a mother of a nearly 12-year-old son, and I fear for his future. I fear for what the future is going to look like for him, what normal will be. We need to fight. We need to unify and stand together and say no.
Thank you so much for your time, Verka. Is there any last messages you'd want to get out for our listeners before you go?
If anybody else is in a situation like me, because it's not too late, it's not the first, if you haven't had the jab just yet, I genuinely wish for you to get the strength up and trust that we need to unify. We need to say no. We need to stand up. We need to speak about it. We need to educate people on what is happening and what other choices there are and what these vaccinations actually are and what they're doing to people. Staying silent is not the best thing to do. We need to speak up. The time is now.
Thank you so much. We appreciate your bravery coming forward and speaking out. And we hope that a lot of nurses, even though they're losing their jobs right now, will be able to come together and get support within the greater community. Thank you. This has been the Raw Report. I'm Ryan Jackson Saw. We'll see you guys next time.